Hello, my name is Louise Huffman. Today I'm doing my speech on 3 types of diabetes: type 1, type 2, and gestational diabetes. Type 1, according to the CDC, which is the Center for Disease Control and Prevention, type 1 diabetes is when your pancreas makes little to no insulin. According to the CDC, it is thought to be caused by an autoimmune reaction. CDC also says it can be genetic, so that means it can be passed on from parent to child. If one thought type 1 diabetes was caused from your eating habits or lifestyle, that is wrong information. That doesn't cause type 1 diabetes according to the CDC. Although that may be true, it may be different for gestational diabetes, and I can explain that later in my speech. If one develops type 1 diabetes, it can take months or even years to develop symptoms. Sooner or later, some of the symptoms may develop according to the Mayo Clinic: increased thirst, frequent urination, extreme hunger, fatigue, weakness, and possibly blurred vision. If you or someone you know develop these symptoms, you should seek a doctor for further evaluation. Some complications of type 1 diabetes can lead to disabling or even life-threatening. It can cause heart blood vessel disease, which can increase stroke, heart attack, or high blood pressure. Another thing it can lead to are kidney damage, eye damage, foot damage, skin-mouth conditions. So you want to seek medical help as soon as possible if you think you have type 1 diabetes. The medical field would do a blood draw to find out whether or not you have type 1 diabetes. According to the Mayo Clinic, there really is no prevention for type 1 diabetes. Now I'm going to talk about type 2 diabetes. It is when the cells aren't responding to normal to insulin. Your pancreas is working to make more insulin to try to get the cells to respond. It can be the cells in the muscle, fat, and the liver which become resistant to insulin. The cells don't interact in a normal way with insulin. They don't make enough blood sugar levels. According to the Mayo Clinic, where I found the most information about type 2 diabetes the risk factors may increase. Type 2 diabetes are being overweight or obese, not being physical active, pre-diabetic, and much more that can be found on the Mayo Clinic website. According to the CDC, type 2 diabetes are very hard to find, and there isn't much information stated on their website. But according to the Mayo Clinic, there are some of the same symptoms of type 1 diabetes, like increased thirst, frequent urination, and increased hunger. A few of the symptoms that I didn't see for type 1, but for type 2, are slow healing sores, frequent infections, and numbness or tingling in the hands or feet. Type 2 diabetes can affect the major organs according to the Mayo Clinic, such as your heart, blood vessels, nerves, eyes, and kidney. We can prevent getting type 2 diabetes by choosing healthy lifestyle. Eat healthy foods, be active, lose weight if you are overweight or obese, and don't be a couch potato and not do any activities for a long period of time. You yourself are the only person with the support of the medical team to control type 2 diabetes if you get it. With type 2 diabetes, you can check your blood sugar regularly, take insulin or any other medication that your doctor prescribes. You should monitor your skin color, manage your stress level, and just focus on your diabetes. It will be better for you and stay on track. My last diabetes I researched on the Mayo Clinic and the CDC was gestational diabetes. According to their website, gestational diabetes develops during pregnancy in women who don't already have diabetes. According to the CDC, that 2% to 10% of pregnancies in the United States are affected by gestational diabetes, while Google scholars on diabetic medicines that 5% to 10% women develop gestational diabetes. Those percents from those websites aren't off from each other and are very close. I was in that percent and developed gestational diabetes with my first pregnancy, but I was fine with my last 2. Gestational diabetes is when pregnant women can't make enough insulin. Insulin is a hormone made by your pancreas that acts like a key to let blood sugar into your cells in your body use as energy. According to the CDC, there aren't many symptoms, and that is the same for the Mayo Clinic as well. Women who are pregnant and don't really know there are blood tests done. Don't know until there are blood tests done. Any clinics in our region or the hospitals do check for gestational diabetes automatically, because those two websites are correct and there aren't many symptoms to tell if a pregnant woman has gestational diabetes. Gestational diabetes can cause risk to your baby. They can be excessive birth weight, early birth, serious breathing difficulties, low blood sugar, or stillbirth. With my gestational diabetes, I had early birth with my twins. I had high blood pressure and preeclampsia, just like the Mayo Clinic explained. There aren't many preventions, but you can choose to eat healthy, keep active, and don't gain so much weight. Type 1, type 2, and gestational diabetes are something you don't want to deal with. Some are hard to find out if you have it or not. All three need blood draws to find out if you have any of those diabetes. I wanted to do my speech on that because it runs in my family for type 1 and type 2, and I developed gestational diabetes. Thank you for listening to my speech, and I hope you found it interesting and found some facts that you didn't know already.